Hey mom, hey dad, it is important that you should get your child immunized or vaccinated to prevent certain types of diseases. Are you wondering about vaccine reactions? Well, these are reactions to a recent immunization. In this video, we will talk about vaccine reactions. What are the common and expected local and general reactions? And which reactions should you worry about and call 911 immediately, or to bring your child to the ER? Or when should you seek help and call your doctor? Also, we will talk about treatment for certain types of vaccine reactions. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Vaccine reactions. So what are symptoms of vaccine reactions? One type are local reactions, which is commonly seen. These are reactions at the injection site and can include swelling, redness, or pain. The symptoms start within 24 hours and these can last from 3 to 5 days. But with the DTaP vaccine, it can last up to 7 days. Another common vaccine reaction is a general reaction, which can cause fever or being fuzzy. And symptoms start within 24 hours, and fever can last from 1 to 2 days. Then, another type of vaccine reaction are delayed reactions, which can occur after an MMR shot or after a chickenpox vaccine, where fever and rash can occur. But symptoms appear much later, between 1 to 4 weeks. Then, the last type of vaccine reaction is anaphylaxis. It is a severe type of allergic reaction, which happens very rarely after a vaccine. The symptoms can start within 20 minutes, and some can appear up to 2 hours after the shot. Vaccine healthcare workers know how to manage these reactions. So, call 911 when your child is having trouble breathing or with trouble swallowing. If your child is not moving or looks very weak, if your child can't wake up, and if you think your child has a life-threatening emergency. You should bring your child to the ER immediately when your child is hard to wake up. Also, call the doctor or seek help now if your baby has a fever and your baby is less than 12 weeks old. If your child's fever is 104 Fahrenheit or 40 degrees Celsius or higher. If your child has a fever after the vaccine and your child has a weak immune system, such as taking oral steroids, has had an organ transplant, has HIV, cancer, or sickle cell disease. Also, you should worry if your child is crying non-stop for more than 3 hours. Also, if your child has had a rotavirus vaccine and is vomiting continuously or is crying severely. And also, you should worry if your child looks or acts very sick. Also, call the doctor in 24 hours when the redness around the injection site has become larger or more painful after 3 days. If your child still has a fever for more than 3 days, if your child's fever returns after being gone for 24 hours, when your child has had the measles vaccine rash present for more than 4 days, and if you think your child needs to be seen. Contact your doctor within office hours when your child's redness or the red streak is bigger than 2 inches, when the redness, swelling, or pain is getting worse after 3 days, and if you have other questions for your doctor. You can do self-care at home if you think your child has a mild and normal reaction to immunization, such as mild pain or swelling and fever after the vaccine. Do you want to know more about common vaccine reactions and treatment for these reactions? Well, before we go to that, are you expecting a baby? How much better life can be when things are under your control upon baby's arrival, where you feel confident about breastfeeding your baby. You know how to deal with a crying, fuzzy baby, when you know how to soothe baby, and when should you worry and call the doctor? And also, you can feel well rested because you understand your baby's sleep schedule. How much better life can be when you get the training in the comfort of your own home. Well, I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. Now, what should you know about common vaccine reactions? Well, vaccines work to protect your child against severe diseases. Reactions such as pain, redness, and swelling are normal at the injection site. You should know that symptoms usually start within 12 hours after the shot. Some redness or fever on the first or second day of the shot are normal reactions. All of these means that the vaccines are working and your child is developing antibodies to prevent and to protect them against real disease. Symptoms may last from 2 to 3 days. There is no need to see your doctor for common vaccine reactions. Now we go to treatment for vaccine site reactions. Again, some pain, swelling, or redness at the injection site is just normal. What you can do is to massage the area 3 times a day or more if needed. You can also apply heat. For pain or redness at the injection site, you can use a heating pad or a warm washcloth and apply it to the area for 10 minutes. If you prefer cold, that is fine as long as you avoid ice. Try not to give any pain medication as much as possible. This is because it may reduce the body's normal immune response. Instead, apply heat or massage the area. If there are hives at the injection site, if it is itchy, you can use a steroid cream or ointment and apply it twice a day. Now, how about treatment for fever with vaccines? Well, fever after vaccines are normal, harmless, and in fact helpful. This is because fever helps speed up the body's immune response. Fever usually begins within 12 hours after the shot and can last from 1 to 2 days. For low-grade fever, such as fever of 100 to 102 Fahrenheit, which is equivalent to 37.8 to 39 degrees Celsius, try not to give any fever medicine. For fever greater than 102 Fahrenheit, or equivalent to 39 degrees Celsius or higher, then you can give medicine for discomfort. Try to give acetaminophen or paracetamol. What you can also do is to give fluids and give plenty of cool fluids. The reason for this is to prevent dehydration. Also, fluid helps lower the body's temperature. And how about clothing? Well, dress your child in normal clothing. If your child is shivering or has the chills, use a blanket until the shivering stops. Remember, all vaccines can cause some fuzziness, crying, and restless sleep. These are usually due to the sore injection site. Some children may sleep more than usual, some may have decreased appetite, and some may have a decreased activity level. Remember that these are just normal immunization reactions and would not need any treatment. These symptoms usually go away in 24 to 48 hours. Also remember, call your doctor if the redness at the injection site is larger than 2 inches, if there is pain for more than 3 days, if your child has had a fever after 2 days, or if the fever has lasted for more than 3 days. if there is pain or redness for more than a week, and if you think your child is getting worse. Do you have a specific vaccine question for me? Well, type it up in the comment section and I'll try my best to reach you and answer them. Hey, if you like this video, watch my next video where I teach you about other child health problems.